Josh, yesterday and then today again to Kevin, you emphasized Republican leaders around in different states as being an impediment to the efficient implementation of the Affordable Care Act. But if we compare the estimated premiums for many ACA marketplace plans as CBO estimated from 2009 to what they are now estimated for 2017, we're actually on track for what those original estimates would have been. And so I wonder, I know we're less than 2 weeks out from an election, but are you, for political reasons, emphasizing that Republicans are the main problem here? Should we be talking about the way that private insurance companies have lowballed their initial premiums and now are coming back, and that's part of the reason for the spike, or is this politics at this point?
Well, Jared, you ask a good question, because there are obviously a lot of factors that have an influence on this process, particularly when you consider that there are some states where the spikes, as you've described them, have been prominent. There have been other states where the costs have gone down. And is that a result of some of the pricing strategies that have been pursued by private insurance companies? That could certainly be part of it. But there's one thing that we do know, which is that insurance premiums are higher, about 7% higher, in states where Republicans blocked the expansion of Medicaid. So I used the example of Oklahoma yesterday, and this really does raise questions. Why would Republicans in Oklahoma prevent citizens in their state from getting access to health care that, at least for the first 3 years, is paid entirely by the federal government?
Are you reluctant to criticize private insurers because they're the partners here, or is it better politics to criticize Republican lawmakers around the country? I'm just, why the focus? It seems like, again, yesterday it was just about these lawmakers. I haven't heard a lot from the podium about the way in which these are essentially on trend for what CBO was originally expecting.
Well, again, I think what I acknowledged yesterday is that the Affordable Care Act is a set of reforms that are imposed on the private health insurance system. And that means there are going to be many decisions, including pricing decisions, made by private insurance companies. And they're all going to have to develop their own strategy for putting forward plans that are competitive. Our reforms ensure that those are plans that meet a minimum level of benefits, and that those are plans that can be made more affordable by offering tax credits. Those are reforms that benefit taxpayers and benefit customers, both because it reduces the deficit and because it makes quality health insurance available to every single American.
I know